More and more alternative health practitioners are beginning to recognize how widespread adrenal fatigue is in the general population. However, mainstream medicine, doctors refuse to recognize that there is a problem with adrenal glands unless you meet diagnostic criteria for Addison's disease or Cushing's disease. These two diseases together affect less than 2% of the population, but some experts believe that upwards of 80% of the population suffers with some level of adrenal insufficiency. Besides the usual symptoms that are of overwhelming fatigue and inability to handle stress, the following symptoms provide a more complete picture of adrenal fatigue and are often overlooked even by alternative practitioners. These things include allergies, sleep disturbances, dizziness, inflammation, low blood sugar, headaches, memory problems, salt cravings, excess thirst or urination, swelling, hemorrhoids, varicose veins, or indigestion. So let's take a look at each one of these symptoms individually. We'll start with allergies. Most allergies involve an inflammatory process. As the adrenal function decreases, allergies worsen. Generally, if the adrenal glands were functioning properly, the body would not respond to these allergens. The same anti-inflammatory effect is important in asthma also. As the adrenal glands heal, allergies are markedly reduced. Next, we're going to look at recurrent infections. Severe or recurrent infections, especially respiratory infections, often indicate adrenal problems. The more severe, the more frequently it occurs, or the longer that it lasts, the more likely adrenal fatigue is involved in the infection. Next, we'll look at sleep disturbances. Cortisol production follows the curve from the highest levels around 8 a.m., dropping down to the lowest levels around 11 p.m. In early stages of adrenal fatigue, the body compensates with high nighttime cortisol. In this case, the person finds it difficult to relax from the stress of the day and has trouble going to sleep. High nighttime cortisol results in reduced REM sleep, which is neither restful nor restorative. This can lead to depression and reduced energy levels the next day. In later stages of adrenal fatigue, the body may produce adrenaline, the fight or flight hormone. It does this in an attempt to compensate for the low cortisol. And this too will result in insomnia. Next, we're going to look at dizziness or postural hypotension. This is when a person stands from a sitting or lying position and the systolic blood pressure usually rises about 10 points as the blood in the lower body constricts to force the body into the heart, lungs, and the brain. This is the result of the action of epinephrine on the blood vessels. In people with adrenal fatigue, the blood vessels are unable to respond to the release of epinephrine because there's a lack of cortisol. So blood pools in the abdomen and pelvis and blood pressure drops. This systolic drop ranges anywhere from 10 to 40 points and is present in over 90% of the people with hypoadrenia. Dizziness is usually present on standing. However, in some people it can present intermittently or constantly throughout the day as even resting blood pressure is low. Paradoxically, in order to prevent pooling of blood in the abdomen and lower extremities, the body may need to keep the blood pressure extremely elevated. Pressure will still drop when the person stands, but only to around 150. But remember, it may have been 180 or even higher before they stood up. Treating the adrenals will lower blood pressure, whereas antihypertensives and antidiuretics will make the adrenal problem worse in many cases. Next up is inflammation. Cortisol and other glucocorticoids produced by the adrenal glands are the body's own anti-inflammatory hormones. People who have responded to injections of corticosteroids into their joints or taken them orally are usually those whose adrenal glands produce insufficient amounts of these hormones. Any person who responds to corticosteroids should be checked for adrenal fatigue. Next up, we're going to look at hypoglycemia or low blood sugar. As the adrenal feed progresses, blood glucose levels will tend to fall too low. The body responds to this low blood sugar or hypoglycemia by causing a person to crave anything that will cause a rapid rise in blood sugar levels, such as coffee, candy bars, or even cigarettes. Often adrenal fatigue leads to abuse of alcohol, marijuana, and hard drugs caused by the need to fix recurrent hypoglycemia. Unfortunately, the rapid rise in blood glucose provided by this fix only serves to start the whole cycle over again. So next we're going to look at headaches. This is caused again by blood pooling in the abdomen and the pelvis, leading to inadequate blood supply to the head. Next we're going to look at behavioral and memory problems. Cortisol even regulates the electrical activity of the neurons in the brain and thus influences behavior, mood, and memory. Behavioral changes frequently occur in both excess and deficient cortisol levels. Sleep disorders, for example, are common with both high and low cortisol. Symptoms more closely related to adrenal fatigue involve decreased tolerance or being quick to anger, decreased clarity of thought, poor memory, or memory retrieval. Next up is salt cravings. The adrenal glands produce many more hormones than just the glucocorticoids. One very important hormone that it produces is aldosterone, a mineralocorticoid. Aldosterone regulates fluid and electrolyte balance, such as sodium, chloride, potassium, and magnesium in the blood, between, and in the cells of the body. As adrenal fatigue progresses, the production of aldosterone lessens. This causes salt wasting. As the salt is excreted by the kidneys, water follows, leading to electrolyte imbalance and dehydration. Those with adrenal fatigue should always add salt, preferably sea salt or Celtic sea salt or pink salt to their diet or to their water. Because soft drinks and electrolyte drinks like Gatorade are high in potassium and low in sodium. The opposite of what someone with low cortisol needs. Commercial electrolyte drinks are designed for those who produce high cortisol when exercising, not for someone who produces little or no extra cortisol during exercise. You might want to add a half or a teaspoon of salt to a glass of water, or either eat something salty to maintain the fluid electrolyte balance. Okay, next we're going to look at excessive thirst and urination. A person with low aldosterone may also urinate 15 to 20 times a day and drink excessive amounts of water. Unless salt is added to the water, this fluid electrolyte balance in the body is further disrupted. Next, we're going to look at swelling. As the body tries to keep the ratio of electrolytes and fluids balanced, fluids may pour into the tissues and cause swelling. Most doctors will only see the symptom and not the cause and prescribe a diuretic, which further compounds the dehydration and electrolyte imbalance and makes the patient worse. Okay, next we're going to look at hemorrhoids. Hemorrhoids are basically varicose veins of the rectum and are caused by blood pooling in the abdomen and the pelvis. When a person presents with hemorrhoids, it is usually due to adrenal fatigue, but it can be caused by liver congestion. Okay, next is varicose veins. Varicose veins of the lower extremities result from the same pooling of the blood in the abdomen and the pelvis that causes hemorrhoids. Next, we're going to look at indigestion. The same sluggish circulation in the abdomen can cause symptoms of indigestion and poor absorption of nutrients. The adrenal glands are a very complex part of the endocrine system, producing glucocorticoids, cortisol being the most important, mineralocorticoids like aldosterone, epinephrine, norepinephrine, and even sex hormones. Adrenal fatigue affects every part of the body and every aspect of life. If you're experiencing the symptoms described above, it is imperative that you find a practitioner and get tested and treated. I prefer saliva testing. because saliva testing is the most accurate test because it shows the rhythm of cortisol production and because it shows how much cortisol is present in the body that the body can actually use. While blood tests only show bound cortisol, which gives no indication if the cortisol is actually available to enter the tissues. And I find that many people who test normal on blood cortisol test very low on the saliva test. I thank you for watching.